Hi. Hi, guys. Hi, everyone. To everyone who's joining in, guys. It's been a super long time since I've been live. And you guys know that, I am a fashion blogger. So, for me as a blogger, I have to maintain that perfect smile, right? And to do that, I think you really need to have good teeth because I am someone who has to be on the camera all the time. And today's live session is going to be all about it. So I will be having Dr. Bharti, who is an orthodontist, and she's gonna come and join in to my live session. She's from Clove Dental. And you guys know that since we need a perfect smile, and for that we need good teeth, there are so many products in the market which are available, but you really need someone for that expert guidance, okay? And to everyone who's joining in, guys, Dr. Bharti is just on her way. I am waiting for her to send me the live request. So, meanwhile, let's just have a quick chit chat session and tell me how you guys have been. And for me, since a child, I've always believed that I should always have, like, you can see my smile. I'm always set. I always keep my teeth clean. I'm very particular about my habits, hygiene, dental habits. Okay, we have Dr. Bharti joining in. Hi, hi.
Hi, Unnati. Hello,
How
everyone.
are you?
I'm good. How are you doing?
Good here. So, guys, we have Dr. Bharti Khanna from Clove Dental, and today we're going to talk about what exactly, she's going to tell you what an orthodontist is, and we're actually going to learn the difference. And for the perfect smile, we'll we actually need that. I hope it's clear, the voice and all.
We are good. We are good, Unnati.
Okay, yeah. So I'm taking it over to you. So please explain us something about, what exactly an orthodontist is and what's the difference between an orthodontist and a normal dentist. So please.
Okay. Hello, everyone. I am Dr. Bharti. I am an orthodontist and a aligner specialist with Clove Dental. And Unnati, yes, we've started on a good note that you are a lifestyle blogger, and this is what I know of you, and you influence so many people around, and we have to talk about
Right.
today. And one of them is teeth and our smile. Okay, so
Yeah.
about teeth straightening. Basically, many of us have teeth which are malaligned, which have
Right.
space. Some people have teeth which are a little forward. Okay, so they obviously influence how our smile looks, and an
Right.
ortho is somebody who corrects that for you. An ortho
Okay.
the
So basically, an orthodontist is someone where you can consult that what kind of aligners, and you need to have an expert opinion. You are the people whom we should look forward to for an expert opinion, right? Okay, so now I have another question for you. So I would like you to tell me that is teeth straightening a specialized treatment, and why a specialized treatment is required for it? I mean, why can't someone just pick in the products that are available in market and just go forward with it? Why would you, you know,
Okay, so when we talk about teeth straightening, we are talking of a process happening in a human body. Okay, it is
right,
not as simple as we don't really place teeth. It's a biologic process. The teeth
mm-hmm,
are embedded in a bony structure. The bone has to change if we have to move the teeth. Okay, and that doesn't happen suddenly. It's a gradual process. It happens at the
okay,
level of circulatory system, wherein a cellular process is involved, which is why a specialist intervention is required. So obviously
okay.
it's a process which involves a lot of biology and application of forces. So again, a great knowledge, I would say, of the kind of forces and the moments that we create for a precise positioning, which is what needs a specialist.
Yeah, I think one should always look forward to a specialist before going and taking such, huge decisions. Okay, I have another question for you, which is, what is the difference between wires used for teeth aligners and aligners?
Okay, so the thing is that when we align the teeth, it
Mm-hmm.
is paths that we take are different, whether we use wires or aligners. The end result is a good smile. So when we
Right.
talk kind of path we are taking, the wires or the fixed braces are the traditional kind of treatment, whereas aligners are something conventional. We've seen it in upcoming
Okay.
30 years maybe, whereas fixed treatment has been there for about 100 years now. When we talk about differences for people who are undergoing treatment, the traditional braces require you to visit us every month for some kind of activation, whereas with
Mm-hmm.
the not really bound, you can go on with the
Okay.
like a self-check treatment. We give you the set of aligners and you can test. Talking about what kind of lifestyle changes both these cause. So with braces, obviously, we ask the patients to avoid certain kinds of food, avoid biting on something hard, whereas with aligners, we do not have any such restrictions. I think people today are a lot more health conscious. The diets are very strict, I feel, and nobody
Yes,
wants.
absolutely. And I mean, because of COVID and all, everyone has started to take care of their, health. They've taken it seriously because in India, I mean, previously this was not a thing, but I think this is really good. This is a great development.
I,
I am going to be asking you the next question. But before that, I also want to tell you that, guys, so I hope you all are like understanding what Dr. Bhati is trying to tell you. So let me just give you a quick overview. So what the thing is that, we have so many products available in the market to regarding, aligners and all of that. So now what happens is, Clove Dental is going to give you the best of doctors. They're going to give you the best of orthodontists who are available to give you the expert guidance. So this is why we have Dr. Bharti Khanna over here, who's going to help us understand what kind of a procedure, what kind of a process. And in case you have any questions, you can also write down in the comments below. We will be happy to answer. Okay, now I will be moving to my next question. So I want to ask you, like, till what age can we do teeth straightening?
so age is actually no bar for straightening teeth. The only thing
Okay,
higher is your dentition to be healthy, to be able to take up those forces, which we check
okay,
with specialized X-ray, which is called an orthopantomogram or an OPG. This is taken in all
okay.
treatments so that we check their bone health, their gum health before we proceed forward. And it there are certain cases wherein if a patient has diabetes, wherein there is a movement of teeth
Right.
or weak, or sometimes the people have bite which is traumatic. Okay, in those cases we have to take a call.
Mm-hmm.
Age is no bar. In fact, I would say that in certain cases it helps to better the teeth health by aligning teeth. If your teeth are crowded, you cannot brush well. Okay,
Right.
deposits, there is a compromise in the gum health. And if you have a traumatic bite, again, the teeth are bearing more forces than they can. This is wherein it
Okay.
helps you not just aesthetically, but also structurally and in the overall health of your teeth.
Okay, so someone who has like sugar or BP, if someone has like both of these things, right? And someone is in their 50s or something, so how would you take the process ahead? Like, would you be asking them for tests? Like, what exactly? I just want to know because, I'm very curious to know about it.
So orthodontic treatment is not it's not a contraindication for people who have diabetes or hypertension. In fact,
Okay.
in diabetes, their gum health tends to give up if the teeth are not aligned. If there are deposits, there are
Mm-hmm.
more any kind of infection. So obviously, if your teeth are
Okay.
well, less deposits and less chance of any kind of bacterial infestation or infection. So it is suggested for
Mm-hmm.
them and align their teeth.
Okay, okay, I got it. Great. I am going to be moving to the next question. So the next question that I want to ask you, what's your view on second opinions? Okay. How is Clove the best place to get a specialized consult and second opinions?
So I would say, as we have understood out of our previous discussion, that orthodontics is a very complex treatment. Okay. Sometimes
Right.
there are two or three variations in the treatment. Why
Mm-hmm.
one need a second opinion is if a person is going for reasons of aesthetics for the orthodontic treatment, I would say that beauty is a perception. Okay.
Mm-hmm.
People feel that their teeth look good in a certain kind of position. One orthodontist might feel they look good this way, the other orthodontist will feel they look good that way. Okay. Which is why
Right.
I come for a second opinion. Second reason for a second opinion would be sometimes the patients are reluctant about getting extractions done, which is done in a few cases if an orthodontic treatment has to be
Okay.
done, which is why patients seek a second opinion. The third reason why people
Right.
would seek a second opinion would be the timeline. Some people have to move out, and if they get to know that their treatment will take about a year and a half, they would seek second opinion as to what are the other options to look for. Okay, so coming to why would you want to seek a second opinion with us would be the reason that we have a huge team of orthodontists here. Okay, and with
Okay.
the experience that we can offer, we would obviously give you a second and a third opinion too. And obviously, it would be taken into consideration your travel plans, your timelines, your need for extractions, aesthetic needs, everything is taken care of over here.
Okay, okay. I think we have a lot of comments also coming in. So how about we can also read them? So Dr. Bharti, there's Megha who's asking us, and she's asking us, "Hello, doctor. I also want to go for aligners because I have crowding, but it's a bit costly, so I have to think twice before taking. So is there any other opinion other than aligners and braces with little affordable, which is little affordable?"
So
So there's another person who's asking, please explain about affordability. So maybe they want to know about the costings and, if you could explain a little.
So the thing is that when we started with aligners, this is, I would say, 10 years back. Yes, affordability was an issue. But now with so many systems coming in, so much development happening in the field, the cost has come down. We start from somewhere around 50,000, and it depends on the extent of correction a patient wants. So we can definitely work it out in some way or the other for the patient, whatever is the best plan. But I feel affordability should never be the issue when we are looking at a good
Exactly. Yeah,
health.
because see, Megha, what I feel is you are actually investing in your health, okay? And जब भी आप अपनी health में invest करते हो, you should actually not see how much it's costing. Plus, Clove is such a great brand. They have so many branches all over India, and they give the best of treatments. I know because my father personally, he also visits Clove only. So this is why I personally have trust on this brand, and they're always, whenever there's a problem or anything, they're always there to answer your calls. So this is the kind of service that we need from you know like this kind of service is something we really need from Clove. And we have orthodontists, we have everyone who specializes in different fields, the dentists and all. And I'm also waiting in for any more questions, but if you could also elaborate a little on the pricing and what kind of things that are available, and something like that, it would be really great for the audience.
The braces that start from somewhere around 27,000 and they go up till about 90,000.
Okay.
Aligners start from somewhere in the range of 50,000 and can go up to 3 lakh depending on the complexity of treatment, depending on the type of aligners we go in for. Okay. The other advantage that I would want to tell you about Clove is that we have a huge interdisciplinary team of dentists. Because, when a patient comes to us, they might not just require orthodontic correction, they will require a few other procedures to be done. They might have restorations to be done,
Exactly.
canals to be done. So
Yeah.
everything is taken care of under a single roof.
Okay, that's great. So, please don't look for any, sasta tikau options in the market. Always go for a second opinion. And Dr. Bhati has discussed why you actually need to go for a second opinion. And that's obviously, I mean, you're taking care of your health, so you really need to talk to the best of specialists to, consult and like go forward with your decision. Now I'm going to be talking about I have another question for you. So, I want to ask you like, how many orthodontists does Clove have, and how does it help in deciding a treatment? Do they consult each other for difficult cases, or how is it like? If you could elaborate on this a bit.
So we have over 55 orthodontists pan India, which is a huge team. Somewhere around 20 orthodontists in the north, 20 in the south, and about 5 orthodontists in the west of India. And we also have a separate team of aligner doctors who help us with the back end work. As far as
Okay.
about difficult cases, we have our monthly reviews, case discussions, meeting wherein the progress of the cases is taken up. There are quality audits done to know the kind of work everybody is doing, the kind of results we are delivering. So it's a fail proof system, I would say.
Okay, that's great to know. Um, I'm going to be coming on the next question, which is what kind of aligners do you use and how long does the treatment take? So, I would like you to explain like everything, like how do you start with the process and how long it takes, and how many checkups are required, all of that.
So, as you would know, aligners are a huge market now. There are so many options at our disposal. So, yes, we have all the options available, from the, I would say, affordable or the budget friendly options that we are talking about to the best in the world, which is Strong and Invisalign. Have everything. We cater to everything. And obviously, we are open to all the options also. Talking about the system of the aligners. So when a patient comes to me and commits to the treatment, we do a 3D scan of the patient, wherein we can see the teeth.
Okay,
We also try to show
right.
us of how the end result is going to be, which
Okay.
because it is, we can picture how the patient is going to look, but the patient cannot picture them.
I'm sorry, the connection got lost. Could you please repeat the previous two lines?
Yeah. So I said the first step would
I
be to do
lost you.
a scan. Am I audible now?
Yeah, actually, I think there's a little connection issue from your end. Um, your voice is not coming really clearly.
Um, yeah. So
So I'll
the
just repeat the question and maybe you can just start over it again. So the question is that what kind of aligners do you use and how long does the treatment take?
Okay, so as I said, we have all the options available, from the basic aligners to Strawman and Invisalign, which are best in the world. Talking about how we go about it, the first sitting would involve a 3D scanning of the teeth, wherein
Scanning, right?
we also show you a simulation of how the end result is going to be. Whenever
Okay.
it is easy for me to picture what the end result is going to be, but sometimes the patients are not able to imagine how they smile. So this is a huge tool wherein they can see how it's going to turn out.
Oh,
The
that's very interesting, I think.
yeah, I think that is the turning point for everybody, because they see themselves smiling in a different manner and in a much better manner.
Yeah, and they feel really happy that, we are able to achieve what we came for.
Yeah. So when we see those smiles on their face, we automatically feel
You
like,
smile, even you smile, everyone smiles. That's great. Yeah, so as you were telling me, so after the scanning process, then we have the next step, which is
the next step would be setting up the treatment on the software, wherein we have to align in 3 dimension each tooth. It's a very precise,
okay.
wherein the dimension, the angulation, everything is taken care of. Even a zero point 0.1 millimeter and a 1 degree angulation is taken care of when we sit to design the treatment. This takes roughly about a week. We share the treatment with the patient on how their teeth are going to look, how the final result is going to be. So when me and them both are
Okay.
happy, and for the final approval and fabrication of the aligners. So this whole process
Mm-hmm.
takes 4 weeks before we can actually kickstart the treatment in the
Okay.
market. Regarding the number of appointments, the
Mm-hmm.
first sitting would happen in the clinic, wherein we might have to place some attachments, do certain kind of procedures in the mouth, and after that, it's kind of optional for the patient to come in as per their schedule. So
Okay.
we appreciate seeing patients every month so that we can track their progress. But in case the patient is not
Mm-hmm.
able, they're traveling, this is like a self-check system. It tracks on its own with each other.
Okay.
So the patients themselves get to know that the treatment is being done, they are tracking well. So this is how the
Okay.
procedure.
And how long does it like take to like get the perfect teeth, like approximately?
I
Um,
So obviously the complexity of each case varies. So the
mm-hmm.
treatment time usually ranges from 6 months to 18 months, depending on what kind of malalignment.
Okay. Okay. And is there something that you need to take care of while you were having aligners? Like, I remember when I was a kid and my friend was having braces, so she couldn't have a couple of things. So is it the same case in aligners? How is it like if you could just let us know on that?
So aligners are, we give you a set of trays, transparent trays. So there's something removable. You remove,
Okay.
you eat whatever you want. Obviously, with braces, there are restrictions, like I told you. A
Yeah.
simple biting on an apple can be compromised.
Mm-hmm.
Have braces, whereas with aligners, you just remove them and go on with your normal life. There are no restrictions
Okay.
at all. You go to a movie, have popcorn, no issues. Whereas
And
with
then you put it back after brushing and like cleaning and whatever.
while brushing, you remove the aligners, brush well. You don't have the hassle of get something getting stuck behind the wires or the braces, or even the wire
Right.
poke. You have to run to the dentist at an odd hour. So all these things are eliminated.
Mm-hmm. Okay. Okay. Meanwhile, I will just check if we have any other comments regarding this. And um, so we have someone asking, क्या अलाइनर ट्रीटमेंट के बाद टूथ वापस पहले जैसे हो सकते हैं? So I think he's trying to say that after the aligner treatment, कुछ maybe कुछ years बाद क्या teeth आपके उसी form में जैसे आपके originally थे वैसे हो सकते हैं or something like that.
Which is a very valid question, because we are trying to modify something in the body. And what happens is, when we bring the teeth into a new position, it takes about a year for them to actually get stable into that position. So that is the period wherein we require something called as retention, wherein we maintain
Okay.
in that position with something removable or with a fixed retention wire which is placed on the inside. So that is taken care of till the teeth become stable, and there are no then relapses. Then if that phase goes through well, if the patient is cooperative, I think we expect a very good and stable result.
Okay, that's great to know. So I'm moving forward with my other question, the next one, which says that how many teeth straightening treatments has Clovia done until now?
I think we have a track record of having done more than 15,000 cases till date, and I
That's amazing.
that number in itself,
That's a
because
huge number.
follow up, our patients keep coming back to us just to say a hello also.
That is true. I completely agree on this because, as I told you, my father has been having a couple of, teeth issues. So even I have, like, her name is Dr. Astha. So we also keep on going there. We like keep on informing, and you guys are just very sweet. And I think the kind of treatment that you guys give us is also really nice. Me as a customer, I'm saying, not as an influencer for now. But yeah, I'm coming to the next question. So, you want to say something? So sorry.
I said we can be doctors to you for a year and friends for life.
Yeah, plus, I mean, you guys are personally so sweet. Like, I've always been to other Clove clinics as well. And right now, you are having the perfect smile.
Thank you so
And I
much.
think smile is something which actually uplifts anyone's mood. So,
Definitely. I think
है ना?
some, a beautiful infectious thing in times wherein we are having
Right,
much.
exactly. And I hope like our smiley faces are making everyone happy right now.
Very
Okay. Yeah, I am coming to the next question, which says that which cities do we have Clove and how it makes a difference in life of a patient? So
So
if you could just let us know.
we have over 340 clinics pan India. We have presence in Delhi NCR completely, Gurgaon, Noida, Faridabad, Ghaziabad, Delhi, of course. And then south of India, we have presence in Hyderabad, Chennai, Bangalore, Pune. Uh,
Okay.
we are there in Ludhiana, Ahmedabad, Chandigarh, Jaipur. So I would say pan India, we all are very connected with
Mm-hmm.
coming in. You would know people have been moving a lot. Some people are working from home, they are shifting cities. So it's a huge advantage in the sense that our system or the softwares which we have has all the
Right.
details built into it. So anybody pan India can access those. If a patient is moving to the other city, his treatment can be continued in that city with all the records and previous treatment history available to the new doctor. And
Okay.
there is not no extra cost involved to it, which is, I think, the major advantage.
Absolutely. Okay. With this, I'm going to be coming to my last question. And after that, I will also be waiting for you guys to, ask in any questions in case you have. So please drop in your comments below. Dr. Bharti is here to help you out. So Dr. Bharti, I have my last question, which says, are the aligner treatment affordable, and how Clove takes care of its patients?
So, as we have talked about the cost aspect, it is, I would say, very much affordable. Probably 10 years back, it used to cost somewhere around 3.5 lakh. And if I say that at the present day, it's costing 50,000, it is definitely very, very affordable with the advantages around it. It's not affecting your
Mm-hmm.
lifestyle. It is not interfering with your oral hygiene. It is not requiring
Right.
frequently. It's aesthetic, of course. People have to take in Zoom calls. So if you have, that's the most pleasant thing to have. So it's
Right.
visible. Nobody knows that you're undergoing treatment. The other technical aspect of aligners that I would like to highlight is that the system of aligners is customized in the sense that
Okay.
it is designed for you. There are
Mm-hmm.
no extra forces applied which are not needed in your teeth. So since it is customized, it is very precise, it is biologically the best system for your teeth, because we are applying very
Mm-hmm.
light forces. We can regulate how much force is to be applied on your teeth. So it obviously
Right.
takes care of patients who have a little weak teeth also. So I think with the
Mm-hmm.
around it, it's something which you would do once in a lifetime, and I don't think we should think twice before going for it.
Yeah, definitely. Um, okay, and so since you were talking about the pricing, 50,000 is where it starts, or like is it for the whole, how is it like exactly? It's like for, because since the aligners are customized, I believe after some time the aligners get customized in a few months. Is that so how it works?
What I'm talking is the complete package.
So you're talking about the complete package, which starts with 50,000, right?
You don't need to pay in
Which
any
includes
visit.
everything, all the
Yes.
visits and everything. Okay, so I think that is pretty cheap, and according to what kind of comfort aligners give, is really nice, because I remember back then, touch wood, I never had any of my teeth which are like here and there. So I had my friends who used to, wear braces and everything like that. And I remember for them, it was such a difficulty. No chewing gums, no this, no that. I have braces on. I look so bad. I'm not able to like look good in pictures. So I think that was a huge thing. And now with the liners, the technology has drastically changed, and this is such a great news, because whenever you feel like, you can remove those aligners and you can eat whatever you feel like and just put it back, right?
Competent world in the present day, and we need something which makes us more confident. I have so many patients,
Yeah.
their early 20s and 30s, who are coming to me who say that we were not able to get it done during our childhood and we want to do it now. So I think
Right.
who we can really help out.
Yeah, and I think me also, like, if I were to, go forward for something like this, you've actually answered so many questions regarding it. Like, even my head is pretty much clear that, okay, I'm not scared to, if I want to go forward for it, I'm not scared to, get aligners and take a second opinion or whatsoever, because this is a matter of health. And I think everyone who invests in health, they should always consult the best doctors, which Clove Dental has. And also you have to make sure that whichever dentist you're going, they're specialized. And like we have right now Dr. Bharti Khanna with us, who is an orthodontist. And Dr. Bharti, we also have a couple of questions, so we'll just take a few minutes to answer those before we end this live session. um, so we have Tripathi ji, who is saying aligner के लिए क्या patient का hygiene भी matter करता है. So if you could just tell us on the hygiene factors, like what all things they have to manage, so that they have an initial overview of how it's going to be like.
So obviously, hygiene is important for each one of us. Oral hygiene being the most important, because we eat from the mouth. That goes, everything goes in.
Right.
Oral hygiene holds utmost importance. And with aligners, I feel like we talked about, the advantage was that we take off the aligners and we can maintain a good oral hygiene. We can floss our teeth, we can use a mouthwash, we can use the brush, we can use the brush the way we like it, the way we feel that it's cleaning well. Obviously, there are
Right.
with the braces, but then aligners have sorted out everything for us, I feel.
And I also had this another question. So in case someone is dealing with, sensitive teeth, because there is sensitivity, like, so is it like, how would, I hope that's not going to be like a major problem if someone wants to get aligners done or something like that.
It is actually not a problem, and in fact it would help in few of the cases. Some people have sensitivity because they have a wrong kind of bite, they grind their teeth at night because of that, and if we can correct the bite, we can prevent that.
Right.
Obviously the sensitivity will also go down with that. So it's not just aesthetics, I
Right.
would.
Okay.
It's about the kind of structure and function that we are seeking in the mouth, which is of importance, and
Mm-hmm.
that obviously helps us to decide better.
Okay. We have another comment. So, Inner Voice is asking, do we have dental insurance in India? So if you could just let us know something on it.
The dental insurance was not there few years back, but now that patients are coming to me, a few of the companies are offering, provided they have a structural requirement for the treatment. Aesthetic requirement is not as yet.
Okay. Mm-hmm.
I think we do have the option of people paying through EMI or Bajaj Finance. I think that kind of makes it easy on the pocket.
Yeah, I think that's a great way. We have our last question from Manisha, who's asking us, um, okay, she's asking us how much experience is, okay, that's not nothing related to, I think you guys can. Okay, we have another question. So, Inner Voice is asking, what material is used in aligners? How different is it from night guards?
Okay, so it's a polymer that is there with a few layers condensed into each other, which makes it very flexible and resilient, which is what helps us to move the teeth.
Okay.
And it's something which is stain resistant, which is temperature resistant. So obviously it's something which is biologically compatible, which goes in the mouth.
Okay, so the quality is obviously going to be maintained, because Clove is a huge brand, and nothing like that is going to happen. So they're going to assure you that they're giving you the best quality and the best services from the best doctors, the best dentists. Again, we have a similar question which says, does insurance cover aligner? So I think that's a no-no.
It does, yes, it does.
It
Because
does. Okay, it does.
it does sometimes. Few companies have started off.
Okay.
As I said, that it is about not just aesthetics, but about the teeth and then obviously overall health. So some companies
Mm-hmm.
have provide insurance, and I think it's going to get better over the years. The kind of options available to us through insurance companies.
Okay, so basically it depends company to company, and that's how you have to check with your insurance company to have that. Okay, and there's another question, which is who was payment? I think the person is trying to ask what all payment modes you guys have. So I think you have cash, card, EMI. You've already told us all of that.
UPI, everything is available, whichever you feel comfortable with. I noted down
Okay,
another.
that's great. And any discounts or anything that you guys offer or you're currently having?
We do have an Ortho Awareness Week going on, which is running from today
Okay,
to over this weekend, and we do have attractive discounts on all our
great.
options. So if somebody is willing, yes, this is the time.
Okay, that's so sweet. And we finally got the comment we were looking for. So we have a comment from Inner Voice who's telling us, thanks a lot. Both of you have a very pretty smile. Well, that is really something that even we were thinking of. Okay, it was really nice talking to you, Dr. Bharti.
Same here, Unnati. I would look forward to connecting with you again and everybody who's there with us.
Same. Yeah, thank you for joining us, guys. I hope all of your questions have been answered by Dr. Bharti. And I think you're doing a really nice job of, making others smile, giving them the perfect teeth they are looking forward to.
So wish you all a happy smiling year ahead.
That's so sweet. Same to you. Bye bye.